Hi, I'm Dr. Lizzie. Yeah, I know you've been waiting and I couldn't give you an appointment for a few days. I'm very, very sorry about that. Well, babies and sleepless nights, but now it's fine. So how can I help you? Okay, let's see. I have your file right here. Okay, well, tell me, how are you feeling right now? Let's see what I have here. Oh, okay. If you're up to have a full examination today, we can do that, but it's gonna take a while. Are you feeling okay? Okay, so tell me, how have you been sleeping lately? Okay, is it less than 7 hours? Okay. Are you on any medication right now? Okay. Have you been recently on any vacation? Okay. Give me a second. Okay. Any allergies that you're aware of? Okay. Any recent surgeries? Okay, and any surgeries at all? Okay. I'm surprised I don't have this information on your file. Well, now you do. Okay. I do plan to go with the full cranial nerve exam today, but if you're feeling alright. Okay. So, are you having any problems with your vision? Okay. Okay. I'm going to come a little bit closer. Just look straight for me, please. You can blink anytime. Okay. Are you feeling a bit tired right now at the moment? Okay. Okay, now I want you to focus at my nose, please. Look right here and try not to blink, okay? It will take only a few seconds. Not more than that. Okay. Look at my nose, try not to blink. Okay. Yep. Now you can blink. Do you think you have any problem with your hearing? Have you ever had problem with your hearing? Okay. Let me see. ask you to open your mouth for me, please? Okay, you can close it. I'll ask you to open one more time. You know, on your left, in the end, you have growing tooth. It might bother you for a while. So if you choose not to take it out, it can give you a headache, just so you know. Yeah. If you want, I can give you an appointment to a very nice dentist. If you want. You don't have to. Okay. Okay, so I'll put some like glasses and I'll close one of your eye. You still can see through it, right? Okay, so if you look through it with your right eye, I want you to tell me how many fingers do you see? I show you. Okay, how many fingers? How many fingers? Okay, can you please follow my finger? Okay, follow my finger. Okay, now I'm gonna point the light. I want you to look at the light. Follow the light. Follow the light. Follow the light. Okay, I'm going to switch this to another side. Here we go. Okay. How many fingers do you see? Right, how many? Okay, how many? Okay, how many? How many? Okay, how many? Okay, I want you to follow the light for me, please. You're doing great. Follow the light. Follow the light. Follow the light. Okay. Okay, now I want you to focus on my nose. I'm going to keep the glass right here. Okay, just look at my nose. It's right here. Whenever you see on your left light appears in your peripheral vision, I want you to let me know, okay? You look at my nose with your peripheral vision whenever you see. Okay, great. Try one more time. Okay. Let's get something red. How about this one? Okay. I want you to look at my nose, and with your peripheral vision, you'll see the red spoon up here. I want you to let me know. Okay, you'll see the red spoon up here. You let me know. Okay, the red spoon up here. Okay. I'm gonna take this off. There we go. Put it right here. Okay. Couldn't do that. I'm sorry. Here we go. Yeah, that's much better. Okay. I want you to look at my nose. You'll see light appear. With your peripheral vision, let me know. Here you go. You'll see light appear with your peripheral vision. See it? Perfect. Let's do one more time. You see it? Perfect. Okay, let's get the red spoon. Whenever it appears, you let me know. You're looking right here. Okay, whenever it appears, you let me know. Looks right here. Okay, I'm gonna try to block your vision now. For now, let's get rid of them. Okay, so can you level your stress from 1 to 10? Your stress level? What do you think is it? 10, it means you're very stressed. Okay. Okay, got it. So now I'll check. I want you to try to relax your shoulders and your head. Okay, you can still move to the sides. Just breathe. Take a deep breath if you want. Take a deep breath in if you want, and out. You can meditate if you know how. If you like it, just relax. Okay. By the way, I'm not hitting you, if you noticed, okay? I'm hitting my hand, but I'm putting my finger on the part I'm trying to examine. Sometimes you hear as it harsh. Don't worry. Okay. I'm going to put my finger in the top of your eyebrow. You'll feel. Okay. Okay. I'm going to put my one finger in between your eyebrows. Okay, this can be very funny. Okay, are you relaxed? Great. Okay. Now you won't be able to see me, but now hammer will go directly at your shoulder. Here we go. Here we go. Okay. Now somewhere around your neck. Okay, that wasn't that bad. Maybe it was. Okay, now I'll ask you to do something for me. Put your head to the side. You choose any side. Okay. Another side. Okay. Now I'll ask you to relax your face. You can keep your mouth slightly open. Okay. Relax your face. Okay, I want you to look at the tip of my hammer. At the tip, 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 at the tip. Okay. Do you think it's hard for you to focus, concentrate on one thing at a time? Or it may be easier for you to be focused on many things at the same time? This is how you can fix stuff, make them done. Or maybe it's difficult for you to concentrate at all. Okay. So if I ask you to look at that lamp for 20 minutes, would you be able to do that? I won't be able to do that. Crazy, right? Okay. There are pluses and minuses at being able to concentrate at many things at the same time, or at one thing, at many things at the same time. It means, now you look at my nose, please. It means you can be able to get done with many things, but then you're gonna level of exhaustion, I don't know, too high, I would say. But it's also great when you be able to fix one thing at a time. And I mean, is that great? But you stay relaxed. I don't know what's better, you tell me. Okay, now I told you to look at my nose, but then I covered my nose. Sorry, it happened, so imagine you see my nose. Just get the point. Where is it? Okay. I'm gonna get the light and I'm gonna swing it between your eyes. You can blink anytime. Okay, now I want you to look at the light. At some point I'll ask you not to. Keep following the light. And would you be able to understand? Do you see the light on one side a bit brighter than on another? Okay, now don't look at the light. Okay, follow the light. Okay, do you think the side is a bit brighter? Okay. I'm gonna look closer to your left eye. Okay, look straight. Okay, now I want you to focus on my finger. Focus on my finger. You're doing good. Look at my finger. That's interesting. Well, not really ready to answer why it's interesting, but let's keep looking, okay? I'm going to put our glasses on your left side. Here we go. Okay. Can you be able to tell me this letter right here? Okay, what about this letter right here? Okay, what about this letter right here? And this letter right here. Okay. Put this up. Okay, tell me if you can see this letter right here. This one right here. This one right there. And this one right here. Maybe you can see this one right there. Okay. like to move to your hearing. Okay, so remind me please, what did you tell me you don't have any problem with your hearing, right? Okay, I'm gonna check pulse right here. Just breathe normally. Okay, let's see right here. Okay. I have no space to put this thing. Okay, let me see. Well, as long as I can see and hear, you don't have any problem with your hearing. But anyway, let's see about the feeling. So I have a tool. My side is a bit harder, the side is a bit softer, so I want you to see if you'll be able to feel the difference, okay? Can you tell me if this is the hardest part? Okay, can you tell me if this hard or soft part? Okay, what about this one? Okay, and what about this one? Okay, so tell me if you can hear any tapping around your ears. Tell me when it stops. Okay. Tell me if you can hear any changes in the process. Okay, that's right. Okay, great. That's something we all know. Snap. So whenever I snap my fingers, I want you to let me know, okay? Right or left? I'm sorry, my left snap is very poor compared to my right one. Anyway, snap is a snap. Okay, right or left? Okay, right or left? Okay, now you won't be able to see me, okay? And directions can be more than just right, left. It can be behind you, under you, on the top of you, and it can move around you. You ready? Okay, take a deep breath in. Tell me. That's right. Tell me. That's right. Tell me. Well, that's great. How How about do you hear that? Okay. Tell me when it stops. Okay. Tell me when it stops. That's right. Okay, now I just want you to relax. Do you feel the pump? Do you feel the tap? Okay. Do you feel the tap? Okay, can you be able to tell me where I'm tapping on the top of your ear? In the middle or in the bottom? Okay. 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 Not bad. Not bad at all. Okay, so now a whisper test. I'll be whispering something. And I want you to repeat after me, okay? Here we go. Okay. That was good. Yellow. Great. Yellow. Black. Pink. Orange. Lime. Kettle. Flower. Okay. Let's see if you have any problem with your taste. So I'm gonna give you something that looks very similar to each other but taste very different. Here we go. If you don't want to swallow, you don't have to, but it's pure organic, you can, just in case. So what was that? Okay. Okay. I'm gonna give you 3 things to try. Okay. What about this one? Okay. Well, I have no idea what you tried, so I hope you're right. I'm joking. You almost did right. So, I would like to examine the sensation around your face. Okay, I'm gonna have a little touch here. Do you feel that? Okay. Do you feel that? Do you feel that? Okay. Right here. Right there. Okay. Right there. Excellent. Right there. Okay. Now can you tell me where you feel it? Where do you feel it? Okay. Where do you feel it? Now tell me, where do you feel it? Okay. Where? 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 move your cheeks out and leave them there. Try to hold them like this. Okay. Good, you can relax. Can you lift your eyebrows and hold them there? Okay, can you close your eyes? I'll try to open them though. Don't let me do that. Close your eyes as much as you can. Don't let me open it. Okay, great, you can open. Okay, I want you to open your mouth. Keep it open. I'll try to close it. Don't let me do that. Good. Okay, close your mouth. Now I'll try to open it. Don't let me do that. Okay, now open and close your mouth. Raise your eyebrows and relax. Okay, poke your cheeks and relax. Do the duck face. And relax. Okay, close your eyes, open, close, open. Okay, great. I want you to smell this for me. This one. This one. And my favorite. Well, I like simpler is better, but sometimes I'll go with the chocolate one. Or strawberry. Or a classic donut. Yeah, what about you? Yummy. Yummy. Well, how about people do... For today we are done. I do believe that you feel tired, okay? We'll continue. I still want to examine your eyes, and this time I'd like to go deeper. So I just don't want to keep you here anymore. You look tired and sleepy. I think you should go and rest, okay? And you can get an appointment for the next time, okay? I just want you to rest, okay? I don't want to prescribe you any medication right now. We don't want to put any pills in you, so just go rest and get an appointment to me one more time. I promise this time I'll be here, okay? We will continue our examination, okay? Here you go. Okay, don't worry, you'll pay for it one time, not for two, but you'll have a full night's examination while you're feeling better. I think you just need to sleep, okay? So try to go get some rest. No caffeine. Okay, can you do that? Okay. And I'll see you again. You're very welcome. Please take care. You're alright.